Welcome back to Your Carolina. So do you have neck or back pain? Well, then this segment right here is for you.
Yeah.
So we have Chi Lim from Orthopaedic Associates.
Yes.
Thank you for joining us.
Thank you for having me.
Well, doctor, we're glad you're here. I
Thank
think
you.
most people have at one point or another back pains.
Yeah, absolutely. You know, there's about, every year about 60% of the patients experience some sort of neck pain or back pain, so very common.
And you are a surgeon, of course, but that's
Yes.
still the last thing you want to do.
Oh, absolutely.
There are other options.
Well,
Yes.
what are some causes? You know, so many people have it.
Yes.
What's causing that?
Well, there's, multiple causes for neck pain and low back pain. Most commonly, it's what we call lumbar back strain and cervical neck strain. It's when we place heavy loads on their muscles in their low back and their neck, and it causes microscopic tears in the muscle and
Right.
causes weakness, and the weak muscles can't support our spine, leading to neck pain and back pain.
What
So
are
if
some
you're-
non-operative treatments? for
At
back pain?
Orthopaedic Associates, we work as a team. We work with a PM&R doctor as well as physical therapist. We do injections and medication treatments as well as physical therapy to try to relieve the symptoms.
Right.
So, we don't do any surgery
That's
eventually.
the last
Yes.
option. Well, Dr. Bayer sees my wife and
Oh.
helps her with
Yeah,
some
great.
non-surgical, pain management. Put it that way. But again, is there anything we can do or a way to change our lives and live differently to avoid those kind of back problems?
First, most common causes neck and back arthritis is genetics, so we can't really change that unless we have
Yeah.
different parents.
Right.
But smoking is the next most common thing. Smoking causes early degeneration of the disc and the joints.
I had never
Yeah.
heard that.
Wow.
And also keep our weights down. That places
Sure.
a lot of stress on our back.
And if you're having back pains, could just losing some weight right there?
Oh, absolutely.
repair back
It's
pain,
like
get rid of it?
it's like the pregnant women. My wife is pregnant.
Yeah, we
With
heard
twins,
about that.
Yes,
right?
with twins.
So she's
Twins, but
real
now here's the
pregnant.
kicker. He just had a set of twins.
I know.
Yes, 3 girls under the age of 4. So
That's illegal in South Carolina.
You are a busy man.
yes, yeah, absolutely.
Well, all right, tell us what you were starting to talk about here.
Oh, so losing just the weight
Yeah.
causes restores the alignment to the spine and prevents any further back pain.
Is there anything that people commonly do, like moving furniture or carrying heavy bags or something, is that we commonly do that we should
Yeah,
kind of
absolutely.
look out for?
With neck pain, people tuck their phone between their ears and their shoulder.
Oh, that
and
can
causes
cause
a lot of
Oh,
neck.
sure.
Yeah.
Well, hold up Karen Carpenter here.
Yes.
Whatever.
Oh,
That's not good. But anyway, the spine.
Yes.
What part of the spine? I know a lot about this stuff because of Mary's surgery.
Okay, so this is the low back and this is the neck. We're talking about arthritis at every level. There's the disc and then there's 2 joints in the back.
Right.
And as we age, you could have the wearing of the disc as well as the joints in the back, which can cause the pain.
When you do, is that the most surgery done in the lower?
Yeah, most
Part.
surgeries are done in the lower back,
Yeah.
about 70%.
Right. Dr. Mitchell.
Yes,
fixed,
Dr. Mitchell,
Mary
yeah.
with surgery a year ago. Then you get to the midsection.
Yes.
What do you call that? The C of the T?
Thoracic spine.
Thoracic.
Yeah, it's not very common to have issues in the thoracic spine unless you have some disc herniations, but
Right.
that can be a different issue, separate issue.
Yeah.
Most commonly, your back pain is going to be in the low back as well as in the neck.
And when does it get really dangerous? I mean, when do you want to make sure you are?
You want to talk to your doctor when you start having progressive weakness. You want to check with your physician when you have arm pain or leg pain. It just means that your nerves are being pinched from the arthritis or the disc herniation.
Right.
So,
Well, talking about pain management, Dr. Bayer gave me a shot in the bursa. That's another problem. Bursitis.
That's not coming from the back. That's bursa from the hip.
Right.
Yeah, so every joint has a fluid-filled sac that allows our skin to move over that joint.
Well, it's nice to be around experts, though,
Yeah.
because I mean, this is truthfully when we're talking about
Yeah.
that. I mean, the back, the spine. It's a complicated thing. I mean, it's so interesting.
Well,
Yeah,
all parts of
absolutely.
the body work, I guess, from the brain and the
sure.
Yeah,
spine.
absolutely.
I mean,
Right.
Yeah.
it's a very complex part of our body.
Yeah, it's our...
Dr. Lim, we need to plug Orthopaedic Associates and make sure, I see a phone number, but
Okay.
know exactly where you're located.
We have 2 offices, one in Duncan on Highway 290 and 85, and we have one over in North Grove on Highway 9 and Boiling Springs.
Well,
So-
welcome. You're the
Yeah,
newest
thank you.
addition. How many doctors now?
There's 10 of us now.
Wow.
Yes.
So if it can be fixed, these guys can do it.
Right there, you go.
Well, we try our best.
Thanks, Doc.
Yes,
Good to
thank
see
you.
so much.
Thank you for
Thank
having
you
me.
for being here.